We are all equal. It's time that we're all heard. Hello, thank you for watching A Voice for All. I am your host, Jahmeelah Gamble, and I trust you've had a wonderful week. Typically on A Voice for All, we cover topics that relate to developmental disabilities, autism, Down syndrome, the disabilities that we commonly hear. But on tonight's show, I have a whole different topic, and I'm really excited to be addressing it. If at any point you'd like to join in the conversation, maybe you have some questions, you'd like to connect with my guests, feel free to tweet me. You could join the Jam Fam, you could email me. So many options for you to reach out to me, and I love to hear from you. So this is really awesome because I feel like all my guests are someone I've known from the past. But this is Brittany Brown from high school. We go way back.
We do.
Way back.
We do.
And anyone who's watching could be looking at you going, okay, you have 6-inch heels, you got a nice braid, nice watch. What is your disability?
Right.
What is it? It's deceiving. It's known as the suicide?
It is the
disability?
suicide disease.
Tell us about it.
It's called trigeminal neuralgia, and it is known as a suicide disease because a lot of people that have it, before there were some treatments available, over 50% of the people that did have the disease were more inclined to kill themselves than to continue on life with it. So it's also known as the most painful disorder known to mankind, and although you cannot see it, it is definitely life-altering and an astronomical thing to have to deal with.
So when did you discover that this is what was going on?
It took a while. About 5 years ago when I was pregnant with my daughter is when it kind of started. And I had a really bad case of shingles on my face while I was pregnant with her, and we treated that. So afterwards, and no fault of my doctor, we thought that I had something called post-herpetic neuralgia, which is an aftermath of shingles. And it wasn't until I went to my neurosurgeon, which would have been like 2.5 years ago, and we were sitting down and I still thought I had post-herpetic neuralgia, and he was trying to explain to me that I didn't. Within 2 seconds of meeting me, he knew it was trigeminal neuralgia, and I was like arguing with him, kind of yelling at him, being abrasive, and my husband had to be like, maybe you should just listen. Right. I think he knows what he's talking about. And that's when we realized what it was, and that the reason nothing was working was because I was treating myself for something I didn't actually have. So about 2.5 years ago is when we realized it, but I've had it for about 5 years.
So every day for 5 years, the pain, how would you describe the pain?
A lot of people describe it, the most common description would be like shocks, being electrocuted on your face, which I'm in agreement with shocking feelings. A lot of it is like being burned with a metal knife as you're being stabbed with it, or your bones being crushed.
So menstrual pain has nothing on this. It has nothing on this.
No,
Wow.
I'm good with that. Yeah, but it's really, really bad. And it's kind of like, at times it's like a slew of like a brain freeze with like bee stings while like someone's like hammering in your bone. It's really, it's hard to describe. My neurosurgeon says like it would wake somebody up out of like a coffin. That's how he describes it. It's an interesting.
How do you deal with this, having 2 children?
That is, it's difficult in more than just having to be a parent. Because there's obviously times where I maybe cannot do the things that they would want or I would want to do with them. I hate having to say to them, Mommy doesn't feel good, Mommy's head hurts. They can finish a sentence for me and have anything taken away from them because of it. But another massive and maybe the most influential part on me is then you feel guilty. And that guilt is a lot more than the pain or the not being able to do stuff. I'm a pretty young mom. We've always been super active with our kids.
Yes, I know that.
When it is nice out, we are outside for like 8 hours. Like we're always doing stuff, and to see them have to change that sometimes it really bothers me. Where maybe it shouldn't, but it does. And then feeling like you're not doing enough for them because of it is hard to accept. It's really hard.
So knowing your story, I know one of the most difficult things that you've been experiencing is the fact that you're going for your third brain surgery.
3. Yeah. 3. Yeah.
I think the only people I know of who have brain surgery is when I watch ER shows on
For sure.
TV.
That's what a lot of people think.
To know someone who's gone through 3, walk us through that. How is that?
It is awful. I have a super high pain tolerance. Giving birth to 2 kids, I was kind of like, who was the person that said that was really bad? Like, I don't find it that bad. I have a really high pain tolerance. Waking up and also suffering every day in pain. Like, you go into the surgery happy that hopefully you're going to wake up and be in less pain on a daily basis. But when you open your eyes from that surgery, I can't describe it. Like, if I did not have children, when I wake up, if someone said, listen, like, I'll either give you your out now, or you can, like, keep fighting, I would be like, just give me my out. Like, I'm good. Like, it is bad. It is so, so bad. And, like, when I had one of my the nurses on my last surgery say, oh, it's not that painful when you wake up from it. A shoulder replacement's worse. So then I said to my doctor before I went in, what is that nurse talking about? She's ill-informed and maybe like shouldn't be working in this area.
Yeah.
And he said, no, she's talking about, she didn't realize what you were having done. She was talking about she thought you were getting a tumor removed, which isn't as bad.
Right.
But my surgery, like, your brain goes into shock, and when you wake up, it is awful.
Oh,
it is
goodness.
really, and it's not the like incision pain or where they glued your skull back on. It is like your brain is in shock from being manipulated and touched, and obviously it's not meant to have that much interaction, and it is absolutely dreadful. For like 2 weeks, and then you kind of are like, oh, I can do it now. It's not that bad.
Well, the reason why I had Brittany on the show, recently in the news, there was a mother in BC who had committed suicide because the pressure was too much of raising a son with severe autism. She had constantly reached out to her community saying, I need help. She was on Facebook. I need help, and apparently no one really heard that cry. And last week, Brittany's on my Facebook, going through Brittany's,
it wasn't as dramatic
through,
as she makes it seem.
Yes, it was. I'm going through my my news feed, and okay, this party, that thing, and then Brittany has one of her posts that she normally does have, but this one really got my attention because to me it was a cry for help. This was someone who was saying, I need help. I need to get the word out. This is what I'm going through. I had the choice to say, oh God, it's another one of her posts, or let me hear her story. And yes, it may not be a typical a Voice for All topic, but this is something that I know the community that you're with, that you guys are dying to get that message out.
Yeah, like, it's not only, I'm sure everybody in this room and anybody watching maybe has not heard of it and has never been affected by it or had any idea it even existed until seeing this.
Yeah.
But I've had GPs that I've gone into, like people in the medical profession, nurses, tons of nurses, when I mention it to them, have no idea what I'm talking about. And something that is deemed the #1 most painful disease in the world, how is that not at some point brought up in people that are studying medicine? So it not only needs to be a little bit more widespread in the average person, but in the medical field. So there's nothing anyone is ever going to do for us if people that are working towards resolving health issues don't even know it exists.
Yeah.
When we're really at there's a small number of us, but the amount of suffering that we do is enough that someone should be trying to resolve something. There's no cure. The medications are awful. You cannot live a life if you're on the medications. The treatments and the surgeries, there's no guarantee.
Yeah.
And there's never, even with the surgery and the treatments, it's not like you're going to be completely normal. It tries to resolve it to an extent. You're not going to be back to normal. So there needs to be just something that gets people aware that it's this bad, and it needs to be at least resolved in some way.
So if anyone who is watching and they may not have what you have, but they have something similar, what tips would you give them to get through this, especially if they don't have, say, a Facebook community or they have someone to talk to? What encouragement would you have for them?
It's hard to say. My personal belief in what has made me as strong as I am with the disease now is being able to research. Yeah. Prior to even being part of a group or having a support group or anything, friends that I've made that have it, which are a massive help to my life now, I spend probably hours every day researching it to an extent that I'm comfortable saying I think I know as much as you could possibly know about the disease. And then finding comfort in understanding what was going on is what allowed me to discover that there were people to talk to about it, and there were other groups, and reaching out to people that were new. Yeah. And being able to explain to them what was going on and what they can and cannot do and what would help made me feel like I had a purpose with it, I guess, which took away a little bit of the negativity and made me feel like I at least was doing something with it. So I would say just being the most informed that you possibly could be. That way, you know, when your doctor's saying something to you, they may not be right. Like I say all the time, they are a human being. They are held on this pedestal that they're a doctor, so whatever they say is absolutely right, and they could never have human error. Well, that's incorrect, and they're just, you know, going by what they think as well. And you could most certainly be right and have them be wrong, and that helps. You have to know what is going on with yourself to be able to reach that point, I think.
Seriously, Brittany. Brittany, like I said, is preparing for her 3rd surgery, and I would hope that anyone who is watching this evening and perhaps you are, you know, you're going through this or a relative is going through this, know that there is a community, that Brittany has, you know, brought that energy, brought that spirit, and up until today, I don't think I ever really understood what she was going through. So please, if you are someone who is going through this suicide disease, do not go by what the name is of the suicide. Know that there are people. Know that there are professionals who are there to assist you. But like Brittany said, do your research. Know what you're going through. Be able to have that voice for yourself to say, listen, this is what I think this is. I don't like how this medication is making me feel. And connect with other people out there. Maybe in the Peel region, we don't have a community for TN as of yet, but we need one. Brittany,
yeah, absolutely.
You could maybe be the head behind this. So really, Brittany has brought so much insight, and I'm so grateful that we got to do this show tonight. And I'm constantly encouraging those of you who, you know, if you have a rare syndrome like this or disorder, connect with us, connect with the people in your community. Know that we are here for you. At any point, like I said, you could email me, tweet me, join the Facebook page. I need to hear from you because, like I said, we are a Voice for All. After the break, Brittany is staying with us. Another great segment. It's been a Voice for All, and I hope you're enjoying the show. Hi, and welcome back to A Voice for All. I hope you're going to enjoy this next segment as I'm going to quiz my guest, Brittany, here. If you're just tuning in, Brittany just shared her story about TN, and I just want to make sure, for those of you who are watching, if you would like to contact the organization or know the Facebook page, I will give you the information now. It is the Trigeminal Neuralgia Association, and their website is www.tnac.org. And you can visit their Facebook page at facebook.com/trigeminal neuralgia. Okay, so be sure to contact them if you or a relative are in need of their services or resources. Okay, Brittany, welcome to the game show of Voice for All. We've never had a game show before, but we are going to have one now, and you're the perfect person for this because, one, you have an awesome personality, and you're easygoing, but two, because you're really like an everyday person who's not in the field of special needs or disabilities. So really, I want to see how much of this you know and what's your opinion on some of these things, okay? So this is like the misconceptions, myths, and facts of disability awareness as a whole. And you'd be surprised to see and hear what some people think when they encounter somebody with a disability. So if you're watching at home, maybe you like to play with your family as well. But Brittany is our victim of today. Okay, Brittany. The lights have dimmed down. Brittany, true or false? Only people who can't walk use wheelchairs.
False.
You're correct. How about this? It's okay to gossip about people who are hard of hearing because they can't hear you anyways.
I'm gonna go with no. I'm gonna go with no.
And are you not hard of hearing on one side yourself?
Yes, I'm.
So
yeah.
when I gossip, should I be on this side?
If you're on my left side, we're good. Yeah, you just do bad words here, compliments here.
I like that. Okay, people can become disabled at any point in their lives. True or false?
Absolutely, absolutely.
And you could attest to that.
An example of that, absolutely.
Right? And you said 5 years ago, going back.
5 years, yeah.
And I'm just going back in case you're just tuning in. 5 years ago, this is when your life basically
took a turn.
Took a turn.
And I was like 7 weeks pregnant with my second child.
Ooh, cowboy. Okay, how about this? People with disabilities prefer to hang out with others who have disabilities.
I don't know if there is just an answer for that. I'm sure they don't prefer just to, as in, they negate relationships with people who are not disabled.
Yeah.
However, I'm sure they do have people in which they
feel
spend
more
time with,
comfortable
and
with.
they have a
Right.
relationship with.
Exactly.
And they have commonalities.
Good answer. Good answer. People with disabilities can participate in competitive sports.
I like to phone a friend, Regis.
You can call me. Call me.
Of course they do. Of course.
And that's going back to Special Olympics, cruiser sports, all great guests we had in A Voice for All. Sledge hockey, guess who brought home a bronze? Our sledge hockey team, and that's a competitive sport. Okay, Brittany, true or false? It is always obvious if someone has a disability.
Definitely not. Definitely not.
Very true, because you cannot tell.
You can't tell with me
We're
at
looking,
all.
you cannot
Right.
tell.
And people think there's nothing wrong with me because they don't believe me.
Right. And would you say that it's harder, since you don't have, say, a physical disability, for people to take you seriously when you explain to them what you're going through?
Yeah, they think there could possibly be nothing wrong with you because they don't see it. They think you're using it as an excuse. And on my left side, when it was really bad before my surgery, I used to get a really bad twitch. And when I'd be ordering at a restaurant or something and I'd get it, the waitresses, my husband would try to say, like, you know, trying to just take it away and just say to them. And it was never like an appropriate response because you don't see something physically
Right,
wrong.
they expect you to be in a wheelchair.
Yeah,
or have a
like a
walking
massive
gun.
ailment.
Right.
There's only like 3 categories. Like you're hindered completely or you're fine.
Right.
And you're just lazy. Yeah.
Well, which brings me to the next question. Most people with disabilities cannot work.
Completely wrong. Absolutely.
And you're working.
I'm working.
You're working and you're a parent.
I am, yeah, which is harder than working. Yeah. I'm going to work for a break from the kids.
Yes, and you know, and going with that point, this has been a huge discussion within Ontario in hiring people with disabilities. Oftentimes, like I said, I've gone to conferences, I've gone to workshops, and they're talking about unemployment and youth unemployment, and we have to get more jobs for the youth. And I always say, what about people with disabilities? They are perfectly capable of working. Do you have hands? Check. Do you have eyes? Check. Do you have the heart and the desire to work? Yes. So why can they not be employed? That's just my rant.
Absolutely.
That's just my rant. Okay. Let's go about this. Oh, the words retard and crazy are harmless words.
Absolutely not, for obvious reasons. Yeah, no.
There's a campaign right now going to this question here for retard. End the R word. Okay, I get that some people use the R word to use it in regards to being slow, if the car is slow, if this activity is slow, whatever it may be. But when you choose to use the R word towards someone as name calling, why? Why do you choose to use that word? I don't get it. I don't get it. The same way within every culture, there are certain harmful words, racial words that people may use against others that it's harmful. Why do people not see the effect of the word retard towards people with disabilities? I don't get it, but if you are someone who uses it towards others, I suggest you stop. That's my rant number 2. Apparently, I'm on rant mode tonight on The Voice for All. Okay, how about this? You don't have to introduce yourself to someone who is blind because they have awesome memories and hearing ability and remember your voice.
I would say that's probably, it would go for anybody, whether they're blind or not. You would do the same for someone who was not disabled. So you would apply the same terms to anybody that is disabled.
Exactly.
There should be no gray area with
Right.
acting differently, unless someone has, say, a hand that they're disabled with. You always
Yes.
know to use your other hand.
Right.
Situations that are complementary to them, sure, but act as though you would with anybody else.
And it's not like they have a sign that says, "Hi, I am blind."
No.
You know,
Like, oh my God, I didn't think you were blind when I first saw you.
And you know,
Yeah.
there are people I never,
sure,
honestly,
yeah.
I had a guest a couple weeks ago, and I did not know she was blind. I met her and I had no clue. And like Brittany says, when you meet someone, you don't just, you sometimes do have to change.
Sure.
You know, one of the questions here is, just because someone is hearing impaired, do you talk louder? You know, you don't necessarily have to do that. You apply certain, I say, behaviors to certain people. There's not one cookie cutter way.
Absolutely.
You know, and for someone who does not work with people with disabilities,
Right.
you seem to have a good handle. And I think it's just because you're human.
Well, also, I would say, like, in the job that I do, like, I'm in sales, and I encounter a large plethora of different people that may not necessarily be disabled, but you adjust your personality for each person you interact with anyway, because no one is the same.
Right.
So the same should apply regardless of how they differ, whether that be a disability or not.
And that's absolutely true, though.
Yeah.
And it goes for, you know, whether it's someone who's old or young with a disability. Sometimes people, when they're children, you know, we talk with this baby babbling talk.
I know.
You know, not necessary.
No.
You know,
don't need to lower yourself.
No.
No.
No, because then you know what? If anything, they're looking at you going,
What
is
are you doing?
wrong with this
and then you
person?
have a 9-year-old going like, beep, beep, bop, bop, bop. Yes.
You're a 9-year-old?
No.
You don't even have a 9-year-old, do you?
No.
How old are your kids again?
4 and 5. Wow. And they are very well spoken.
Yes, they are. I can
Because we
second
have
that.
always spoken to them like adults.
Speaking about your kids, one thing I remember about your kids is dancing, especially your daughter. And one of the questions here is, true or false, people with disabilities can dance?
I would be willing to say that most disabled people can probably dance better than I can. So I would say that is false. They can bust a move.
They can bust a move. And speaking of dances, there are certain organizations within the Peel region that do offer dances for adults with various disabilities. And a couple years ago, I was working one of the dances, and they told us the strict rules. You know, they're not allowed to grope. They're not allowed to kiss or make out or anything like that. And these guys are adults, right? And this one girl is making out with her boyfriend, and her eyes are open. And I felt awkward stopping her because she's an adult. But when she was dancing, I thought this was like some nightclub in like Vegas or something like that. And I'm like, you go.
Absolutely.
You go. When you have a disability, just because you may be visually impaired, you might have a speech impediment, you might be missing a hand, doesn't mean you can't dance. Everybody has a little soul.
You have movement. Yeah,
Brittany, you have soul.
I don't have a lot of soul, but
None?
I don't know. What distract you on, and I think I do.
We'll help you find it. Brittany has, I would say, passed the Voice for All game show quiz. I will say
that.
But I want to end the segment on just some guides, some tips. I don't even know why I have to read this. I would hope that we as a society just know how to treat anybody and everyone and not have to pull out our special golden book for when dealing with people with disabilities. But certain things, always ask before giving assistance. You would be surprised that there are some people who take great just assault when you automatically move into, oh, let me get this for you. Let me do this for you. They have that independence. They want to show they have that independence. And I know sometimes you just want to jump in and we want to help, but please make sure you ask for, if you could step in and assist them. Another question, think before you speak. And the reason why I say this, I work with a couple of families, and the one big pet peeve they have is when someone meets them and their child with a disability, and they say, that must be so hard. You see that little filter in your brain? I suggest you listen to it, you think before you speak, and know that everyone has a personality, everyone has a heart, and regardless of what their ability or their disability may be, we can greet them and get to know them just the way we get to know everybody else. So thank you, Brittany, for being my guest.
So much. I appreciate
Best co-host ever. I hope you enjoyed this episode of A Voice for All. Like I said, contact me below. I love to hear from you. I always appreciate your comments and your questions and your show suggestions. And I hope you tune in next week. I ended it.